Namaste Bitia, Hamisha Khush Raho Bitia. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series of lectures, we are discussing about the diseases of the temperature regulation. In the last lecture, we have discussed about hypothermia. That is the disease of the increased temperature of the body and the various clinical features, the investigation and the management of hypothermia. In today's lecture, we are going to discuss about hypothermia. So hypothermia was that in which the temperature, the core temperature of the body was increasing. And today we are going to discuss about hypothermia. Hypothermia is a condition in which the core temperature of the body is reducing. So let's start with the hypothermia. So I have discussed about you in the last lecture related to thermoregulation. So I will just have a quick review of that thermoregulation once again. Body temperature is controlled by hypothalamus. This we have discussed that hypothalamus is responsible for maintenance of the body temperature, and it is directly sensitive to the changes in the core temperature. So whenever there is any change in the core temperature, hypothalamus is responsible for maintenance of the body temperature, and it indirectly responds to the temperature sensitive neurons in the skin. Now there is a normal set point of core temperature that is regulated within the range of 37 plus minus 0.5 degrees Celsius. This we already know that the normal body temperature is 37 degrees Celsius or 98.6 degree Fahrenheit. And this varies with plus minus 0.5 degrees Celsius, which is necessary to preserve all the normal functions of the many enzymes and other metabolic processes that are going on in the body. So 37 plus minus 0.5 degrees Celsius is the optimal temperature in which all the homeostasis is maintained, all the mechanism of the enzyme action and the metabolic process takes place in the body. Now, what happens in the hypothermia? In the cold environment, the protective mechanism includes, so whenever the body is exposed to the cold environment, then there is a protective mechanism that includes the vasoconstriction, the cutaneous vasoconstriction and shivering. So this is the way of increasing the body temperature. However, any muscle activity that involves the movement may promote the heat losses. So these movements can also promote the heat losses by increasing the connective tissue loss from the skin and respiratory heat loss by stimulating the ventilation. Now, in a hot environment, the opposite mechanism takes place, which includes the sweating to increase the heat loss. And this occurs when the ambient temperature rises above the 32.5 degrees Celsius during exercise. So we are more in this lecture, we are more concerned about the hypothermia. Hypothermia is observed in the cold environment when the protective mechanism is that includes cutaneous vasoconstriction and shivering, and any muscle activity that involve movement, it can promote heat loss. So the body try to prevent that heat loss from the skin and by the respiratory losses. Now we come to the hypothermia. What is hypothermia? What is the etiology of hypothermia? What are the clinical features, investigations, and management of the hypothermia? This we are going to discuss in today's lecture. So what is hypothermia? Hypothermia exists when the body temperature, the normal body temperature, is reduced. The thermoregulatory mechanism is not able to maintain the body temperature in the optimal range. Therefore, hypothermia will exist, and it will exist when the body is unable to maintain the heat in a cold environment and the core temperature is falling below 35 degrees Celsius. So hypothermia, it also occurs in the healthy individuals. So hypothermia can occur in the healthy individuals and those individuals in whom thermoregulatory mechanisms are intact, but insufficient to cope up with the intensity of the thermal stress. So hypothermia occurs in the healthy individual whose thermoregulatory mechanisms are intact, but insufficient to cope up with the intensity of the thermal stress. Now, what is the etiology of hypothermia? The infants are susceptible to hypothermia because of their poor thermoregulatory mechanism and high body surface area to their weight ratio. So most commonly hypothermia can be seen in the infants because their body is not able to maintain the thermoregulatory mechanism, and also the body surface area to the weight. This ratio is also very less. The body surface area is very high in comparison to the weight of the children. Another important condition that is responsible for hypothermia is the hypothyroidism. So hypothyroidism is often a contributory factor in the old age. Alcohol and other drugs commonly impede the thermoregulatory response in the younger people. So in the younger people, if the individual is taking alcohol and the other drug substances, and these substances impede the thermoregulatory response in the younger people. So if a person is taking too much alcohol, then it can stop the thermoregulatory mechanism, or it can affect the thermoregulatory mechanism. Secondary to hypothyroidism, if a patient has hypothyroidism, secondary to this condition, glucocorticoid insufficiency can take place, and the stroke or hepatic failure or hypoglycemia can be seen. So in response to the hypothyroidism, there can be glucocorticoid insufficiency, there can be stroke, hepatic failure, or hypoglycemia that can be seen. Hypothermia also occurs in the healthy individual in whom thermoregulatory mechanisms are intact. So hypothermia is not only seen in the diseased individual, but it can also be seen in the healthy individual. In those, the thermoregulatory mechanism, although it is intact, but it is insufficient to cope up with the intensity of the thermal stress. So if there is any kind of thermal stress, if there is any kind of cold that is present around us, and the body is not able, the thermoregulatory mechanism is not able to cope up with that particular thing, then it can result into hypothermia. The types of hypothermia that results from this deficient thermoregulatory mechanism includes acute hypothermia, subacute hypothermia, and chronic hypothermia. So we have acute, subacute, and subchronic, because it cannot be for too long duration. So it is having acute hypothermia, we have subacute hypothermia, and subchronic hypothermia. In the acute hypothermia, when an individual is immersed in the cold water, when the core temperature may fall rapidly. So if a person dives in the cold water, or if a person is subjected to very cold water, icy cold water, then it can be responsible for the reduction in the core temperature of the body. That is called as acute hypothermia. Subacute hypothermia is when there is exposure to the extreme climate, like during hill walking or onset of slow onset hypothermia. So if a patient is slowly ascending uphill, then the temperature falls, and that is known as the subacute hypothermia or the slow onset hypothermia. The third variety is the subchronic hypothermia. Subchronic hypothermia is seen in the individual that are immobilized. That is, it is seen in the immobilized older individuals. Infants are susceptible to hypothermia because of their poor thermoregulation and high body surface area to the weight ratio. This I have already discussed with you, that in the infants, hypothermia is very common because of the poor thermoregulatory mechanism and high body surface area to the weight ratio. Hypothyroidism is a contributory factor in the old age especially, and in the young people, alcohol and drugs, this impede the thermoregulatory mechanism. So this we have already discussed. Now, what are the clinical features? Depending upon the core temperature, the core body temperature, the hypothermia can be divided into three varieties. First, we have mild hypothermia. Second, we have moderate hypothermia. And third variety is the severe hypothermia. So in the mild hypothermia, when it is seen when the temperature goes below 35 degrees Celsius and is above 32 degrees Celsius. So in the mild hypothermia, there is cold and shivering. So the patient is subject to cold and shivering. There is mumble, stumble, tumble. We are going to observe mumble, stumble, and tumble in the patient. And the patient is very much lethargic with too much dehydration and tachypnea. So there is cold and shivering with mumble, stumble, tumble. There is lethargy, dehydration, and tachypnea that you are going to see in the patient. Second condition is the moderate hypothermia, when the temperature is, the core body temperature is below 32 degrees Celsius and is above 28 degrees Celsius. In the moderate hypothermia, you are going to observe violent shivering. There will be violent shivering with the slurred speech, slow labored movement will be there, and ataxia with mild confusion, and there is pale and blue lips. So what happens in the moderate hypothermia? In the moderate hypothermia, the core body temperature is below 32 degrees Celsius and is above 28 degrees Celsius. You are going to observe violent shivering with slurred speech, slow labored movement, ataxia, mild confusion, and pale with blue lips. The third variety is the severe hypothermia. Severe hypothermia, when the core body temperature is going below 28 degrees Celsius, but is above 23 degrees Celsius. So in severe hypothermia, there is cold but not shivering. The skin is cold and pale, and there is depressed consciousness. The muscles become stiff, and there is bradycardia and hypotension. So in severe hypothermia, the core body temperature is below 28 degrees Celsius and above 23 degrees Celsius. There is cold but not shivering is seen. The skin is pale and cold. There is depressed consciousness with muscle stiffness, and there is bradycardia and hypotension. Now, there is another condition when the body temperature, core body temperature goes below 20 degrees Celsius, then you will observe coma. There will be undilated and unreactive pupils, and there can be cardiac, heart can become to the standstill position. Now, what are the various investigations that could be done in case of hypothermia? In case of hypothermia, you can check the blood gases. So blood gas analysis can be done. A full blood count with electrolytes, chest X-ray, and electrocardiogram can be done. These are the essential investigations. Blood gas analysis, full blood count, electrolytes, chest X-ray, and electrocardiogram. You can also check for the hemoconcentration and metabolic acidosis. These are common. And the ECG may show characteristic J wave, which occurs at the junction of QRS complex and ST segment. There are different types of cardiac arrhythmias, including the ventricular fibrillation that may occur, the arterial pressure of oxygen, partial pressure of oxygen, in which the blood falls by 7 degrees for each 1 degree fall in the core temperature. Serum aspartate, aminotransferase, and creatinine kinase may be elevated in the secondary to muscle damage. So if there is any kind of muscle damage, then serum aspartate, aminotransferase, and creatinine kinase may increase. The serum amylase is often high due to the subclinical pancreatitis. So serum amylase level will be raised, and additional investigations for the thyroid and pituitary adrenal dysfunction, hypoglycemia, and the possibility of drug intoxication should be performed. So in addition to the above mentioned things, you can go for thyroid and pituitary adrenal dysfunction test, hypoglycemia checking, and possibility of drug intoxication can be performed. Now, how to manage a condition of hypothermia? So the objective of the management of hypothermia is to rewarm the patient in a controlled manner. So you cannot just directly warm the patient, but the rewarming has to be done in a controlled manner while treating the associated hypoxia, the fluid and electrolyte imbalances, and cardiovascular abnormalities, particularly the arrhythmias. First of all, we have to, the management consists of two stages, management of the mild hypothermia and management of the severe hypothermia. So in case of mild hypothermia management, there is continued heat loss, and it has to be prevented by sheltering the patient from the cold, replacing the wet clothing and covering the head and insulating him from the ground. So in case of mild hypothermia, when the core body temperature is not too much low, and if the patient has drenched in the cold water, then we have to remove the patient from the cold water. We have to change the clothing, replace the clothing, and cover the head, and insulation from the surface of the ground has to be done. Second is the management of the severe hypothermia. Severe hypothermia, when the core body temperature is going below 28 degrees Celsius, the patient with cardiopulmonary arrest, that is non-perfusion rhythm, or those with cardiac instability, when the systolic blood pressure is going down below the 90 mm of Hg or vascular arrhythmias, then it has to be controlled. The aim is to restore the perfusion, and rapid rewarming at the rate of greater than 2 degrees Celsius per hour is required. Now we come to the cold injury. Cold injury, there are sometimes in the examination, a short note are asked on the cold injury. They are not directly asking from you about the hypothermia, but in short note, they can ask from you about the cold injury. So cold injury is a very small topic, and the investigation and management of the cold injury remains the same that we have discussed with the hypothermia, but it's a little bit different to describe. So let us understand about the cold injury. Cold injuries includes the frostbite, the trench foot or the immersion foot, and the chilblains. So there are three varieties of cold injuries that we are going to study: frostbite, trench foot or immersion foot, and the chilblains. The clinical features, the investigations, and the management almost remains the same. The clinical features we are going to discuss here itself. The investigation and management remains the same as that of the hypothermia. So first of all, let us discuss about the frostbite. So freezing cold injury, that is known as frostbite, it results from the direct freezing of the body tissues and usually affect the extremities, the fingers, toes, ears, and face. So fingers, toes, ears, and face are affected. And the risk factor include the smoking, those people who are doing smoking, the peripheral vascular diseases, dehydration, and alcohol consumption. So those people who are taking alcohol, who are smoking, who are having peripheral vascular disease and dehydration, all these people are at risk. The frostbitten tissue is initially pale and duffy to the tough and intensive to pain once frozen and the tissue is hard. Now, how to manage the frostbite? The management of frostbite is by giving oxygen and aspirin 300 milligram. Frostbitten extremities should be rewarmed in warm water. So you have to put the cold extremities or frostbitten extremities in the warm water, that is having the temperature between the 37 to 39 degrees Celsius with antiseptic added, and adequate analgesia has to be given. The second variety is the trench or the immersion foot, that is the non-freezing cold injury. Why does the trench or immersion foot or the non-freezing cold injury occurs? It occurs because of the prolonged exposure to the cold or damp conditions. The limb it is affecting usually the foot, and it appears cold, ischemic, and the numb. But there is no freezing of the tissue because it is due to the constant wetting of the extremities in the cold atmosphere. So there is no freezing of the tissue that you are going to see. On rewarming, the limb appears mottled. So if we are rewarming the affected limb, it becomes mottled and thereafter becomes hyperemic, swollen, and painful. The recovery may take months, and during which the period there may be chronic pain and sensitivity to cold can be seen. So this is all about the trench foot and non-freezing cold injury. Third variety is the chilblains. What are chilblains? Chilblains are very common, and you are going to see chilblains in a lot of patients. Chilblains are tender, red, purplish skin lesions that occur in the cold and wet weather. They are often seen in the horse riders, cyclists, and swimmers, and are more common in the women than men. They are short-lived and although painful, and it is not usually serious. So chilblains, you are going to observe in a lot of people, and winters, a lot of people are getting affected. And we have very good homeopathic medicines for chilblains like agaricus and many other medicines that can be given. So the investigation of all these things we have already discussed previously with the hypothermia, and the management remains the same. So this is all about hypothermia. So we have discussed in the previous lecture about hypothermia. Today we have discussed about hypothermia. So this completes the thermal injuries. Many times full question is although not asked, but short notes are asked on hypothermia, or the cold injuries. So now you are well aware of it. Now it's a homework to prepare the therapeutics of both the condition of hypothermia and hypothermia. The homeopathic therapeutics have to be prepared. And also I have given you the questions in the portal on the e-notes that I have provided. So you also have to complete the answer to those questions. So this was all for today. This session is powered by Digital Version 2.0 JAYOTI VIDYAPEETH Women's University. I hope the session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.